Hi everyone, good morning. How are you all? I hope we are doing good, guys. Hello, people from YouTube. Hi, Dr. Priyanka. Good evening, actually. Hi, how are you?
I'm doing good. How are you?
Yes, great, all good.
Thank you for having me here today.
You're most welcome. Okay, so I think we can start. We have a good number, and other people will be definitely joining. So, guys, okay, there are around 20 people in YouTube as well. Very nice, very nice. Okay, so guys, let me just start with the webinar. So first of all, I would like to thank you for coming to this wonderful webinar on health informatics and career abroad for the pharmacy students, everyone. And why I'm saying thanks again because we usually don't conduct the sessions on Sunday 10 a.m. We understand then how after a full week of exhaustion, students sleep and they take rest. So, but we have to meet with the time of our experts as well, and that's why we are conducting. And we are very thankful that you all are joining here. I can see almost 200 people are joining in two channels. So, and the reason is because the topic is wonderful. Frankly, the topic is really wonderful, and we are going to talk about something very new. Even I would like to learn, about the health informatics. This is why because the FAMD is very new in India. It's just 17, 18-year old, and the first batch has come in 2014. Only 10 years, 11 years, and people are still not very clear about the career options and not very clear about the master degrees, not very clear about the higher education. So that's why when I saw, Dr. Priyanka's one of the posts in LinkedIn, so I immediately contacted her, and for last few weeks we were talking, and we then fixed this. Like I asked her to join me and join us and guide you guys, right? So this will be a fantastic webinar, frankly, because you are going to learn about something new, and most of you are even planning to go abroad, planning to do health informatics as one of the new career option for all of you. So without getting late, I would like to tell you some instructions as looking into our back webinars, last week webinars. You will not be allowed to chat also today till the webinar ends. Okay, we already got your questions, right? So we will ask those questions to Priyanka, and after that, definitely you will be open to chat and you will be open to speak once the webinar is done. Right, this is live webinar definitely, but we don't want any kind of glitch right now. So we are keeping our speaker in different room. So she will be talking to you, she will be telling all the aspects, and then once it is done, you can ask your questions to her. You can ask your questions to her later, right? And second part is very important, that at the end we will be sharing a feedback form, which is also your attendance form. So whoever is staying till that time and filling that form, wherever, we will share in YouTube also, we will share in Zoom also. So whoever is filling that form will get the certificate webinar, and it is important because you are sparing your Sunday morning 1.5 hour to us and to the learning. So it is very important for you to get the rewardings in certificate, right? So you will get the certificate, but only after completing the webinar, we will share the attendance form. Okay, so with that, guys, let me take this privilege to introduce Dr. Priyanka. So Dr. Priyanka Bodagla is, PharmD from Bangalore. She has done her PharmD from Bangalore, from the Rajiv Gandhi University of Health Sciences in 2020. And then she went to US and Then she did their health informatics. She did the Masters of Science in Digital Health Informatics, which she has recently completed from the University of San Francisco, California. And she is right now working as health informatics analyst, data analyst, digital health and informatics specialist in San Francisco itself. Right? She has many professional experience like informatics intern as Motive Medical Intelligence, at research interns at modality.ai, medical writer at can rheumatic and immunology center and research India in 2022 to 2023. So with the vast experience and multiple projects in hand, she has a great experience where she can guide you like how to go for MS in health informatics, how what is exactly health informatics. She will help you understanding the concept, and she will definitely help you understanding the path how she went there. So we'll be talking about her journey as well. She will be talking about her journey as well. So let's stay tuned, guys. So over to you, Dr. Priyanka. Thank you very much for joining us.
Thank you, Dr. Rajat. Let me just share my screen and then I'll start.
Yes, sir.
Mhm. Yeah. Good morning, everyone. Thank you so much for being here today. And before we dive in, let me introduce myself again. Dr. Ajit already told me. So I'm a family graduate from India and then pursuing masters in digital health informatics at the University of San Francisco. My work mainly focus on transforming clinical data into actionable insights using different tools and uh, data uh, data visualization and AI driven analytics. So beyond that, I also worked over 2 years of experience as a medical writer, creating the healthcare content to spread knowledge to wider group. And my passion mainly lies exactly at the intersection of the healthcare, technology, and education. And today I'm here to empower you to explore exciting opportunities in this field. So let's so the main key takeaways from this webinar is about firstly, we will discuss, you will understand what is the health informatics and why it matters globally. And then the second, we will cover the essential skills you will need to stand out. And third, I'll walk you through which countries offer the best opportunities and also the pathway to build a career abroad step by step. So let's get started. What is health informatics? So, health informatics is where technology meets the healthcare delivery to make patient care smarter, safer, and faster. And it's the engine behind EHRs, telemedicine platforms, wearable health devices, and even AI diagnostic systems. Real world example is like during the COVID, telehealth has been exploded and informatics teams were behind enabling these virtual patient consultations overnight. For pharmacy, it means e-prescribing platforms, automated inventory management, medication interaction alert systems, etc. And the fun fact here is that the first computerized drug interaction checker was built in 1960s. Imagine how far we have come back here today. And this field is valued at around 65 billion globally, expected to double in the next 5 to 7 years. So, in short, health informatics is shaping the future of healthcare, and pharmacy is also a very big part of it. And the next comes, why is health informatics important globally? Let's look at the global trends that make informatics so important. The first thing is that WHO reports 55% of the 58% of countries now have national e-health strategies, and that's more than half of the world. And the second, the post-COVID telehealth usage has been skyrocketed by 300%, and the patients, doctors, pharmacists, everyone shifted to the digital platforms. The third comes to healthcare workflow efficiency improved by 25%, where digital solutions were implemented. So, In the UK, the NHS National Health Service deployed remote monitoring for COVID patients at home and by reducing the hospital admissions and saving lives. So another example is that in Canada, pharmacists use electronic systems for real-time adverse drug event reporting and dramatically improving the drug safety. These changes are here to stay, and pharmacy professionals who understand these technologies are in huge demand in current situations. And next comes to the let's talk about how the pharmacy and the health informatics connect to each other. So, medication management systems track every step from prescription to patient handover and minimizing the errors. And when it comes to the pharmacovigilance, these platforms monitor drug reactions in real time, which is very important for post-marketing surveillance. And the next is the automation. Smart dispensing systems are reducing the errors by up to 87% and freeing the pharmacist to focus more on the patient care. The important thing is clinical decision support. Imagine a system that automatically warns if two prescribed drugs could interact badly and saving lives. So one of the example here I would like to mention is that at Mayo Clinic, pharmacists use AI-driven alerts that integrate the seamlessly into the EHRs, which reduces the uh, adverse drug events significantly. Your pharmacy background plus these informatics skills can be a powerhouse combination. And let's discuss about the essential skills and certifications that can help you build your profile better. So, professional certifications like CPH, IMS, and CAHMIS, RHIT, and EHR proficiency are some of the uh, professional certifications which gives you credibility, especially when you are looking into build your career through in the hospital or healthcare system roles. Some of these certifications you can earn after you have some experience, but there are some entry level certifications that are available for the students that you can take an exam and get the certifications done. And what are the skills that you have to when you are looking your health career in a healthcare technology? So some of them are like learning basics of SQL for database queries, Python for automation, and R for the statistics, Tableau for visualizations. So you don't have to worry about mastering these coding skills. Mainly, you have to focus on understanding how the healthcare data workflows. So when it comes to the domain knowledge, regulations like HIPAA for the USA and then GDPR in Europe are the understandings very essential. And when it comes to the soft skills, communication is crucial because you will work with the doctors, IT teams, administrators, and not just the pharmacists. So, you can learn all of these skills by using different platforms like LinkedIn Learning, Coursera, or even many videos in the YouTube offers beginner courses. This can be a small start, but can stay consistent. And let's talk about some of the top destination countries and entry level positions. And uh, so when it comes to the USA, there are popular roles are the clinical informatics pharmacist, which blends the patient care and the tech, and entry level salaries lies between 85,000 to 92. And again, the salaries uh, are purely based on your location and your experience level. This cannot be a correct number, but it can be an average for entry level positions. So there in UK, NHS digital specialist, and in Canada, healthcare data analyst. In Australia, e-health implementation specialist, and in Germany, pharmaceutical system coordinators. These are some of the popular roles in these countries. And some of the top employers are like when it comes to the hospital sectors, the Mayo Clinic, Cleveland Clinic, NHS Trust, Extra, and health tech companies are like Epic Systems, Cerner, Teladoc, and there are many startup companies nowadays. And the consulting firms includes the Deloitte, PwC, Accenture Healthcare, and the government and public health agencies include the CDC, WHO, and NIH. So, what are the pathways to a career abroad? So, when it comes to the education, if after the pharmacy, you can take the degrees in masters in health informatics, clinical informatics, and based on the universities, the concentration might vary, and some of the curriculum texture uh, characteristics or the courses can vary. But yeah, the main degree can be a health informatics, clinical informatics, or healthcare management uh, are the popular for if you are looking into the healthcare technologies. And if you want to gain some of the practical experience, you can do internships or level positions during your OPT or the in the USA, which comes for 1 to 3 years, and you have National Health Service digital schemes in the UK, and also you can get more research experience by doing some of research assistantships. So when it comes to licensing, if you are mostly into the pharmacy degree focused and also you want to have some informatics knowledge, grow your career with pharmacists and more into a informatics role, then you can do some licensing registrations by doing the by passing these pharmacy registration exams like FPDE, NAPLEX, MPGE or CPGE for USA. And then there are some colleges or the universities that offer pharmacy residency once you get your license done. And these residencies offer mainly the course called Pharmacy Informatics if you are most interested in this. And there are many other courses too in emergency department, etc. And when it comes to Canada, it is PEBC, and when it comes to the UK, it's OS, PAP, and GPHC exams. And the next, what are master programs after pharmacy abroad? Finally, let's talk about the study options. So the first is direct MS in health informatics. This can be a top choice if you want to work on healthcare IT systems, EHR optimization, and clinical workforce. And like I said earlier, the next is pharmacy informatics, specialized focus on medical related data systems, e-prescribing, and pharmaceutical supply chain technology, which are available in different universities like Northeastern University, University of Wisconsin, Utrecht University, which has a program length around 1 to 2 years. And the next is MS in digital health, which can be exciting if you are drawn to mobile health apps, wearables, telemedicines, digital therapeutics. And the next comes is the MS in biomedical informatics. For those who passionate about combining the genomics, clinical research, and AI, this is one of the best program that which is the MS in biomedical informatics or bioinformatics. These are mainly available at Stanford University, Karolinska Institute, and University of Melbourne, which also has a program with about 1.5 to 2 years. So next, talk about the career paths after you have your master's in health informatics. And so if you want to go into a clinical informatics pathway, then you would become a clinical informatics specialist, decision support analyst, by helping optimize uh, patient care through better EHR system and workflows, or a clinical decision support analyst, which is like building tools that guide doctors in making safer, faster decisions at the bedside. And sorry, you could also work as AHR optimization specialist by tuning the EHRs like Epic or Senna. And then, if you want to focus on who wants to stay in a pharmacy practice tied with the informatics, then you have pharmacy informatics pathway, roles like pharmacy informatics specialist, which focus on medication management systems and drug safety alerts. Or you could also manage automated dispensing systems, but those smart machines that now help distribute medications more safely and efficiently. And then, if you love working with the numbers and patterns, there comes the health data analytics pathway that can be your calling. And you can be a healthcare data analyst, clinical data scientist, healthcare analytics specialist. And these are all where you use predictive models to anticipate the patient outcomes. Analytic is the heart of value-based healthcare, and data scavvy pharmacists are in high demand for these roles. And when it comes to, if you are more interested in telehealth and digital health pathway, you can coordinate telehealth programs, making healthcare accessible to the rural or underserved communities, or specialize in developing mobile health apps like medication reminders, chronic disease management apps, and virtual consult platforms. And then, if you enjoy leadership and strategy, you could move into a healthcare IT consulting. Some of the consulting firms like Deloitte, PwC, Accenture are hiring health informatics professionals to guide digital transformations across the healthcare systems. You could also be a digital health program manager, which could be leading major hospital IT upgrades or app development teams. And then, if you are interested in making an impact on largest population, you could become public health informatics specialist, working with the CDC, WHO, or national health departments, or manage clinical research data for drug trials as a clinical research data manager, essentially for bringing new treatments to market safely. And then finally, there is a whole world of emerging roles, and you could also specialize in AI in healthcare, training and validating AI models that predict the patient risk, or become a FIRE developer, which is the fast healthcare interoperability resources developer, helping systems speak the same language across the hospitals, pharmacies, and insurance companies. Another exciting area is the pharmacovigilance informatics, monitoring the global drug safety using advanced information informatics systems. So the next is what are the key steps and success stories. So how do you make yourself stand out? You can build a digital portfolio by creating mock EHR dashboards, writing case studies about the drug safety systems, and doing many projects with the professors, or doing some research with the professors if you are having anybody in your university. Or you can always get in touch with anybody and connect with the people on LinkedIn. And network smartly by attending many global health conferences like HIMSS and IMIA, or LinkedIn groups for global connections. And you always have to stay updated by subscribing to some of the journals like JMIR Healthcare Informatics, Health Affairs, Digital Health, and there are many. And then uh, There are many success stories where Indian pharmacists at different clinics working on EHR optimizations and others researching pharmacy informatics innovations. The the key point you have to remember is the persistence is key, and international career building is a marathon, not just a sprint. So let's this when it comes to the final closing points here. I hope today you realize that PharmD is not just the end; it's your launchpad to global opportunities in digital healthcare. And I will conclude by saying some things about the health informatics. It's not just about the computers or databases. You don't have to worry that you don't have a good technology knowledge. The main basis you have to have your healthcare terminologies and standards, and then some of the basics knowledge about the programmings like Python or SQL. All this you can learn through many platforms like Coursera, LinkedIn, and Google also offering many courses on these topics. If you combine your pharmacy expertise with these technology, you can be a pioneer in the future of the healthcare. And you can transition between these pathways and can climb higher and even build multiple areas uh, like clinical plus data science and pharmacy plus digital health and many more. So, with I would like to conclude with saying that with health informatics, your career possibilities are not just global, they are truly limitless. Thank you so much. And this comes to the end of
Thank you
my
very
presentation.
much, Dr. Priyanka. Thank you for this wonderful uh, webinar and enlightening session. So, guys, now we are allowing you to actually speak. You can speak and you can chat and you can put up your questions and yes, please go ahead with your questions, guys. Hi, everyone.
Uh, can I ask a question?
Yes, please be
Uh,
louder.
Sir, I'm PharmD intern from Bangalore.
Hi.
And hi, sir, and thank you so much for this webinar. Um, my question is like, I had this opportunity to attend this um, class to like hands-on workshop on bioinformatics, and they had taught me about string and stitch, and also I had attended another hands-on workshop, and it was on drug discovery and molecular docking, and they had taught us few basic things like using Chimera and Pyrex, and I was really interested at that time, and I was coming back home and I was doing all the stuff. And 2 days later, I just realized that I spoke to a friend who was doing biotechnology degree, and he told me that people who do masters in biotechnology, though they go into bioinformatics. So it's like a hindrance to me. Like when there are already people who are going into bioinformatics, is it worth it for PharmD students who study 6 years and to go into a different field? That's my first question. And second question is, and now if I go into field like bioinformatics, will it be like a complete disconnect? Will I like disconnect myself from studying all these like therapeutics and things like that? And will it be like going into something new, like starting from the scratch? So these two questions are like hindering me from taking further steps. And also my third question is, in like right now I'm not in a state where I can leave my country. Is there like any opportunities in our country, like you know so these are my three questions. So I would like uh, the speaker and you to throw some light upon these
Sure,
doubts.
definitely. First, Dr. Priyanka, please go ahead.
So, the first question you are asking, is it worth doing the bioinformatics after a PharmD? So, it depends mainly on your career options that you are choosing. Especially if you are passionate about combining the pharmacy, biology, and data science, the bioinformatics opens doors into the drug discovery, personalized medicine, genomics, and clinical research fields. These are growing massively nationwide. Uh, so even when I'm looking here, I recently came noticed about more opportunities in the bioinformatics sector too. This actually has a different curriculum compared to the PharmD. So you can use the PharmD degree as your basic requirements to meet or to enter or apply for the degrees in bioinformatics as a master's. Yeah, and the second question you ask is, are you going to, if your family knowledge is going to be of no use after going into the family? No, you don't have to think about that. So the family actually plays a base for your degree if you want to pursue bioinformatics. It plays a strong clinical and medication science expertise. And the bioinformatics adds the powerful ability to work with the genomic data and computational drug design. If you enjoy this research, data, and innovation, a move into the bioinformatics after PharmD can be a really future-proof for your career. So yeah,
Okay.
bioinformatics is a very good thing. And you mentioned if you don't want to do a master's, you can still do some of the courses in Coursera. There are some bioinformatics based specialization courses that are mainly provided by the Stanford universities and uh, University of California, San Diego. These are very good courses. I would recommend these two courses mainly if you are more interested on the bioinformatics. Yeah.
Ma'am,
And
Yes.
you,
my
I
other
would like
question.
to add to this. I would like to add to Dr. Priyanka. This is a wonderful question. Actually, I expect such questions from our students, and they are really woke about their career, and they ask such a brilliant question. See, I'll tell you, after doing PharmD post-baccalaureate, completing my PhD in cardiology. You won't believe that I have completed 6 years back. My PhD in cardiology, I have completed 6 years back. My PharmD post-baccalaureate, I have completed 12 years back. And almost 11 years back. And now, this year, from February and March, 2 months dedicatedly, I have completed my short-term course in bioinformatics. Okay, now I will come to your questions. First question is like if it is for use or not. Definitely it is for use. Okay, definitely it is for use. See, why I'm telling is because see, PharmDs do not know in India exactly what to do, where to go, right? So this is the era, this is the time, like the time which is going on for past 10 years and for upcoming 10 years, in the next 10 years also, for this 20-25 years
साला कर पाना तुमसे तुम्ही
for PharmD. So these 25 years for PharmDs are to explore. Okay. These 20 years are to explore the new reasons, to the, new scopes, new opportunities. And what I found is, maybe we are very apprehensive going to the new areas. We are very apprehensive to going to the new areas like bioinformatics or AIML, or to go to the these fellowships, or some different kind of like MPH, Masters in Public Health. What we think is, we think like, okay, these are no use, or there are very limited seats, or there are limited vacancies or limited job options. And what we actually thought is, you clearly mentioned that we think, oh, people are already there in medical license jobs already. This is for MD pharmacologies, or this is for the MDs, right? So there are many, hindrances, what, stops us actually, going to the new things. But I always teach my students, I always teach them, I always tell them, please go out of the box. See, frankly, PharmD is not for clinical pharmacist. It is for clinical pharmacist, but not in India. Why it is? Because after 5 years, you will be saturated and you will not have any option to grow. You will be, no option. You will have no options to, sustain after some years. If you don't have any additional degree, if you don't have any, any kind of additional certificates or any MBA or masters in public health or whatever, right? So you have to choose something very strong, very much out of the box. And if you are going to that path, definitely people will go. And that was the only agenda of conducting today's webinar, because Dr. Priyanka is doing health informatics. Okay.
Yes.
So yeah, so now everyone is on mute. So that was the main agenda of today's webinar, even because, see, I want you to get inspired and do something which no one has done yet, or very few people are going to a new path. Okay, so don't feel competitive. Don't feel, because I'll tell you another story here. It's very important. I always tell my interns, my students, see, one of my in 2020 in 2012, when I joined postbaccalaureate second year, I saw that someone from family postbaccalaureate, the first person has joined Novartis as medical license jobs were only reserved for MBBS and MDs, but he cracked Novartis and he joined that time with the 80,000 rupees per month job after family postbaccalaureate, 13 years back. So guys, you have to do it. You have to make the way for your upcoming generations in family, and this is nothing which is where you are not suitable. Okay. And the thing about the courses, there are the courses in India as well. Don't go everywhere. I'm not telling you to opt for the courses if you don't have the options to go out. If you have the options to go out, choose wonderful universities which are already established with such courses. But if you cannot go outside, please, there are some universities like Manipal University provides 4 years in bachelor's of bioinformatics, 2 years in master's in bioinformatics. And I did my, because I'm here, so I saw this course and I joined. I usually conduct, I every day used to go from 5 to 7 in the evening to attend the classes every day. Right. So you can attend online, offline courses from such prestigious universities. Not everywhere. I have seen bioinformatics is conducted by many universities, but choose some reliable and good universities. And I'm telling you, they taught the syllabus of masters in 2 months. Every day something new. Every day something new. Every day something new. But if you want to do something masters or some courses, please do it from some good universities. And as CS suggested, from the Coursera also has wonderful universities where they're providing the bioinformatics courses. Okay, so always go out of the box and don't feel competitive as you are feeling. There is no space for competition. Maybe there are people already, but in India we did not have the PharmD, right? We did not have PharmD, but now we have PharmD, so we have to make our place by ourselves. Understand? That is the main thing you have to understand. And please, if you are thinking to go for bioinformatics or something like that, and one more thing you have added, how it is useful. See, I'll tell you, she has told how PharmDs can be. It is a wonderful base. You have a beautiful base of therapy. You have a beautiful base of therapeutics which you can use there. Okay. And let me tell you, I'm from the research background. I'm doing research for last 10 years and published many papers. And why I've joined bioinformatics was with the only one agenda: then I will learn and I will apply into the research. You can apply genomics, you can apply pharmacoinformatics, you can apply health informatics, you can apply bioinformatics into your research. So solidify your base with the research. It is wonderfully it will be helping you whether you are going to the academics, whether you are joining the industry, whether you are joining the research centers, you are joining the ICMR. Just apply bioinformatics. If you are learning bioinformatics or something like that, apply that to your job, to your students, to your personal career. So that will definitely help you. Okay, I'll not take much time because there are many questions, guys. So yeah, over to you, Dr. Priyanka. You can open your mic.
So yeah, that is what I would like to say. I totally agree with Dr. Rajat. You can always do courses online if you are don't want to pursue a master's. You can just do a short-term courses. Yeah.
Yeah, so there are
Okay.
questions. Something first, I will take one question from the people have submitted before only. Neha Satya Gauravi has submitted this question from Andhra University. So this is a very beautiful question. Ma'am,
Mhm.
I am now planning to join MS Health Informatics, and I was able to secure a seat in University of Michigan starting this fall. Given that I am from family background, what are the prerequisites for this course? Is it necessary to have technical background? If so, what language or technical knowledge should I gain before starting my master program? Also, any useful websites or link to upgrade my skills? I think about skills she has told, but the person, the student wants to understand your real time experience and how she can improve when she are going. So this is, I think, one of the very relevant question, Dr. Priyanka. Please address this.
Yes, I will. Yeah, I was also having same question when I was getting admissions into the Masters in Health Informatics. So, firstly, congratulations on your admit in the university. University of Michigan is one of the best university which offers the Masters in Health Informatics program. And when it comes to the prerequisites, uh, you can have a basic knowledge in programming, that which is a Python and SQL mainly. You don't have to have advanced because again in your master's degree you have a curriculum where they help you in gaining knowledge and getting advanced learnings in these uh, technologies. And all of these technologies you can learn by your own through YouTube channels and like I also there is Udemy and Coursera and even Google courses. So there, I can also recommend if you are mostly looking to do some kind of small course, I can say that you can do a data analytics in healthcare or Gen AI in healthcare, which are offered by Google Cloud. Yeah, this should be mostly enough when you are going to start your masters. And then again, when you are doing masters, you will gain more knowledge and many new technologies during because they have a wonderful curriculum there in that career. Yeah.
Yeah, so yes,
Mm-hmm.
guys. Okay, I hope this answers your question. And if you want to speak, please raise your hand. We will, open your mic. Okay. So next question, if I would like to take is from Rajesh. If I take bioinformatics or biomedical informatics, what will be my career options? Will I be dealing with gene and drugs as well? And if I am having overall 70% in my family, can I apply to this kind of courses? He has two questions.
Mm-hmm. So yes, so after PharmD, you can always apply for the bioinformatics course. Like I also mentioned earlier, your PharmD acts as your base and prerequisites for doing masters in bioinformatics. And when it comes to the different career options after doing bioinformatics or biomedical data science, you will be at the interaction of the biology, medicine, data, and technology, which helps in drive a personalized medicine, drug discovery, and clinical research innovations. It opens up many career opportunities where you will work with both genetic information and drug development. So the some of the careers you look here are the bioinformatician and genomic data analyst, genomic specialist, clinical genomic researcher, and AI in drug discovery researcher or biomedical data scientist. So all these career opportunities, you will work with mainly the genetic profiles and to develop personalized treatments and helping the pharma companies in identifying the new molecules or repurpose these drugs. And also uh, the clinical genomic researcher, you will be studying the links between the mutations, diseases, and integrating the EHR and the genetic data to predict the data. This is to predict the disease risk. And when it comes to the AI and drug discovery researcher, designing the algorithms for finding the novel compounds is one of the key thing you will be working on.
Yeah.
So, yeah, that is what I would say
So
on
same
this.
question I got from Mihika here.
Mhm.
She is telling that I'm the final year BPharm student and I've got admission to a master's course in health informatics at Indiana University for fall 2025. I'm interested in health, data analytics, and data science. Before I go for my master's, are there certain things I should do? I think this is completed. Now we were answering this
Yeah.
only. What specific skills we
Mhm.
have already discussed? Are you talked about making a digital portfolio? What kind of projects should I make? I have no work experience. How should I get started? I think that is additional. Am I required to learn maths
Mhm.
also for this?
Mhm. Okay, so when it comes to the additional projects you want to build on to add into your portfolio, you can, it also depends on your main interest. You can do some of the predictive analysis in detecting the cancer in patients and those kinds of projects. And then you can also do omics genomic projects if you want to get both the health informatics and the bioinformatics uh, pathways. And if you want to be more specific, you can do some patient appointment scheduling analysis, mock project, which is like analyzing the appointment data from a mock hospital database to identify the booking timings and no-show rates, etc. And also you can do create a dashboard tracking reported ADR over time by using the open data sets which are available on Google. And all and you can also do EHR data migration simulation, which is simulate the transferring patient data from an old database structure to a new fire compliant system. And here you'll be using the skills of fire structure, SQL transformation queries, and all. And why this is good is like if you are more interested in the data interoperability, which this would be a hot skill, and especially with the fire standards adoption globally. Yeah, I would recommend some of these projects if you are interested to build your portfolio before starting your master's in health informatics. Yeah.
Yes, wonderful.
Mhm.
In the, when we take the questions before the webinar, almost all are about the career
Mhm.
options and what are the skills required for health informatics. But there is one more question by many of the students. Are there any scholarships available? And if there, what are the scholarships and what are the, processes to, get those? If you can enlighten us on something like that.
Okay. So when it comes to the scholarships, it depends on the universities, and some of the universities have the research assistantships or teaching assistantships that you can apply for, and those positions will offer you the scholarships for covering your tuition fee. It might not be fully, it can be a partial, or they can give you some stipend based on their university rules and regulations. And and you can also do uh, graduate assistantship positions as well. These are some of the things you can look into. And again, some of the universities, if you go into their websites, uh, they do have some of the uh, links to their uh, provided funding opportunities, like some of the global health services that offer the scholarships. And there are some organizations like HIMSS, and if your university has recognized with the HIMSS, then they might help you in, if they have some of the scholarships available, you can apply them, and based on their requirements and everything, if you can gain scholarships there. Yeah,
Yes,
but
and
I won't say it's 100% scholarship you will get from every university.
yes, and guys, if you have attended our career conclave last month, we have conducted. This was a 5 days program. You will see that we have conducted that conclave, and we have discussed all these things. not only in India but abroad. Okay, we have called many people, many students, and many experts from those universities, and they have talked about that. And one of our university, I mean, one of my students only is in in US, and she got the 100% scholarship for women. Right, so you can just search because every university, different states have different universities. Okay, so I'll just see questions. If they are related to health informatics, we will take. Otherwise, we will skip for today. Okay, for getting a job as a CRCA, CRC, CRA, is it required to have at least 1 year of clinical experience? But in curriculum of PharmD, it is not included. So how can we show the experience at earliest? No, there are multiple jobs. There are many companies, startups, and the even big companies. They provide the internship. So it is not necessary to get directly into the job, or it is not necessary to have the experience. Join these companies at intern, and then they will absorb you directly from there only. Okay, and it is not necessary for every company that you have the experience, because if they think like that, they will not have the people, right? They will not have the new hirings, right? So it's not necessary to have the experience for CRC or CRA job. Usually CRC and CRA jobs starts in hospitals, so please join some, some kind of projects, some kind of clinical projects in hospitals, funded projects in hospitals, and then work on this. Can start my coding journey from pharmacy. I believe it's journey. Can start my coding journey from pharmacy? Definitely. Pharmacy is one of the best background to join the medical coding, because you know all about the disease, right? And all about the pharmacotherapeutics, all about the condition. Ma'am, I'm studying second year Pharm D, and I'm interested in subject like pharmacotherapeutics and pharmacology, which is the best career option for me. Okay, you would like to answer, or shall we skip this question because not relevant to health informatics right now? We have many questions. Okay,
You can go ahead,
yeah.
Dharaj.
Do pharmacovigilance courses add weightage to PharmD students, and can you please let me know which countries are demanding for pharmacovigilance? Okay, any idea on pharmacovigilance? Which countries? I'm not sure, guys. Frankly, I'm not sure which
Yeah.
countries are good for pharmacovigilance. Literally, I feel India is one of the biggest population in the world. We need more pharmacovigilance people, and we have more, vigilance related jobs, that I can assure you for sure. Okay.
Yeah.
In the US, where do these courses, which universities to pursue? Okay, we have talked about many universities. So if you can just line up 5 universities, Dr. Priyanka.
Yeah, there is one University of Michigan, Indiana University, University of Pittsburgh, then comes the University of North Carolina and University of California, San Diego, and San Jose State University. These are some of the very good universities that have the healthcare informatics programs.
Yeah, where to do cardiology in pharmacy? No, cardiology in pharmacy means you have to have a family background and apply to multiple universities. Now they're providing the clinical PhDs like JSS. Manipal is one of the major, and they give the good stipend also. Right now they're giving 35,000 per month. Even better than joining as assistant professor for 25,000. So you can join the PhD and do a wonderful job. You can complete your PhD and get good stipend, guys. Okay. Currently, I'm pursuing PharmD intern. Kindly mention about the certificates I can pursue. I think it's done. Pave my path in informatics. Okay. Yes, this question we can take. Madhushri. Hello, ma'am. I am currently pursuing my M.Pharm in pharmacology. I'm very much interested in starting my career in clinical research internationally. Could you please share what pathways are available for students like me to enter the field of health informatics or clinical research abroad?
So again, when it comes, if you are interested in clinical research and health informatics, there are direct courses, the masters in health informatics and masters in clinical research. It depends on what you want to choose. So both are different master degrees. So you can choose whichever you are interested in. And
Okay, sir.
also again, if you are in health informatics, you can always do a research. And if you are in clinical research, you can always have your you can do the research which focuses mainly on informatics.
Absolutely, absolutely.
Yeah.
No doubt. No doubt. Okay,
Mhm.
so Kesab Bihari is asking, is clinical research what courses would be good to integrate with Farm D? in clinical research, what courses would be good to integrate with PharmD? See, clinical research is a wide domain. You can join clinical research as 6-month course, 1-year diploma or 6-month diploma. You can do medical writing, pharmacovigilance, clinical data management, medical coding, or anything. All the domains are related to clinical research. It's totally up to you what you want to choose, where you want to pursue, right? What experiences
Yes.
are prime for MSL in foreign nations? Yeah, I have no experience, frankly. I can understand, I can tell you about the medical scientific license in India, but not in foreign nations. If Priyanka has some
Mm.
answer to that, she can.
Uh, Unfortunately, even I don't have
Yeah,
any
frankly, I,
experience
I should
related
not
to that.
I should
Yeah.
not misguide you telling that I know everything about MSL in foreign nations.
Mhm.
I have no idea, frankly, guys. Okay. Since in USA at this time, but I can definitely get someone from outside for MSL for you guys. Okay. I'll try to talk someone and take one webinar on MSL in international space, wherever it is. So since in USA at this time after Trump, things are very hard. Is there any possibility that after doing MS for 2 years, opt visas are not easy permitted to students or what? Are you facing any kind of challenges, Dr. Priyanka?
Currently, I'm not facing any challenges related to the OPT after masters. You don't have to think about the administration and all those challenges. If you are very good at your career and you are very genuine and working hard, this can help you in achieving the good job opportunities and gain. You can and OPT visas are not cancelled, so there are still you can still apply for the OPT once after doing your masters, and they you unless and until you have some you have done something illegal or you don't have a genuine proofs that about the job or whatever you are working on, there you don't have to worry about visa revocations related to this. Yeah.
Definitely, yes. That's important
Mm.
part. Okay, sir, I'm currently studying in PharmD fourth year. Sir, is it worth to do master in public health after PharmD and how to apply? See, it is definitely worth. As I'm telling, go out of the box. Everyone is going for clinical pharmacy. Everyone is going for academics. Everyone is, doing some common jobs. Okay, don't go for that. If you really want, go for public health. I have taken the specific 1 to 2 hour session on masters on public health 2 weeks back. You can check in our our YouTube channel. So definitely see, masters in public health doesn't just make you or give you the MPH degree. Okay, it will make you epidemiologist, it will make you statistician, it will make you public health officer, it will make you the groundwork officer for ICMR, it will make you the health officer, scientist, clinical scientist, public health scientist. Many jobs are related to MPH are available. And let me tell you, in India, there are 7 colleges, I mean, 7 institutions related to PHFI, Public Health Foundation of India, and they just entertain MPH people. They just entertain public health people. Okay, so there are a lot of things. How to apply? There are few institutions in India, as I told you, Manipal is one of the good institution, frankly, not being the advocate, but yes, you will get the wonderful education here, wonderful exposure here. We have wonderful hospital here. So if in India you want to do, you can choose Manipal. And if you want to go outside, go to UK or, what we say that UK, Denmark, and Australia. These 3 countries are really good if you cannot go to US. Okay. So these 3 countries are wonderful for masters in, public health. Okay. Ireland, sorry, not Denmark, Ireland. Okay. Ireland and UK in European region and Australia are 3 top countries to provide masters in public health. I am a BPharm student. How can I pursue masters in bioinformatics? It's simple. As we were talking about the process, you can join the master's course in bioinformatics from India or outside. You can apply and you have the valid degree to get into. Mihika's question we have already taken. Okay. For getting a job, CRC we have completed. Kesab Bihari done. Amulya is having questions. Sir, what about masters in clinical research? How it is this field? I think we have answered this question. Relevant questions we have answered. What's the technical skills required for data analyst? I'll skip this question, guys. Can I PharmD graduate work as a DMO in tertiary care hospital? This is a myth. You guys are just being extorted in Andhra Pradesh and Telangana and Tamil Nadu. So it is totally up to you, your choice, because I have addressed this issue many times. This is a fake. Do you guys get the letter of appointment on their letterhead? Do you guys get the salary in your bank account with salary slips? If you can answer this question, I will tell you, go and join the DMO. They are just extorting you, giving some money, placing you instead of doctors in the night duties, day duties. This is just a myth. Okay, there is no DMO post for PharmDs. Even in the MCI or NMC, they don't entertain this post for PharmDs. Not at all. Okay, there is no such position in Indian scenario, in Indian regulations. So if you are really loving extortion on you, then you can definitely do it. But I am never in the favor of this DMO part. Okay. Okay, so sir, after 2 years of regulatory affairs, will there be scope or not? Definitely there are. Regulatory affairs is one of the wonderful, job option, because this is one of the integral part of clinical research, from the, finding a, what we say, the molecule, to the, all type of clinical trials, all stages of clinical trials, post clinical trial surveillance. You need regulatory affairs people. Mihika's question we have taken. Pharmacovigilance, I'm not taking right now, guys. In India, MS for college name. I have completed foundry. Please explain about EHR. MS in India, they don't provide in EHR. They provide MSc in health informatics and bioinformatics and such courses, but they don't provide MS in India, as per my knowledge. Do you know anyone, Dr. Priyanka, in India, which provides
Not
the?
really.
No, they don't.
I never heard of this
Sniper has recently
particular
very,
person.
yes, Sniper has started MS for medical devices. That much I know. In India, no one provides, and if they are providing, also please don't trust right now, because they are very new. If somebody is offering this, first find out if they have all the resources, all kind of softwares, all kind of knowledgeable person. That's important. If the trainers are good, okay. What is the development status of India in using technology in healthcare? Wonderful. I'm telling you, it has gone from 13 billion dollar to $43 billion in last 5 years. Okay, and expected till 2030, it will be around $100 billion. Okay, in India itself, about using the technology in healthcare, and in healthcare, all type of technology. I'm not just telling, but this is a very booming area. Okay, 1 second, guys. Hello. Yes, I think we have taken all the questions. Good morning, sir, ma'am. Can you please suggest some institutions which train AI and ML? We provide AI ML diploma. You can check our Curio website. Okay, guys, you can check our website of Curio. So I'll just mention here. We provide the full-fledged diploma in AI and ML. Okay. And this is our third batch right now going on. So who is this? Hello. Yes, guys, I'm so sorry. Okay, so I think we have taken all the questions. Is there any specific question which we can take? Let me just read, because we'll
Yeah,
go for further.
I'm seeing one question which is very interesting. It's related to the family in abroad.
Yes,
I
please.
would like to read
Yeah,
about it.
please
So,
address that.
Jenish Virani was asking, I know a lot of people are asking the questions regarding this, but most importantly, after PharmD, one can apply for the NAPLIX or FPGEE or all of those exams. But after completing the course of 1 to 2 years in US, what's the basic procedure? I mean, what should one do after completing any further course in USA? So if you're aiming to become a licensed or registered pharmacist in USA, that's a lengthy process. You cannot directly just do the PharmD licensing here because you need to have some internship hours that needs to be completed as per the state you are trying to get the license in. So yes, the first step would be writing a TOEFL exam, coming to the USA, and in the USA location centers, you have to give that exam. After passing that, you will be eligible to submit all the documents related to your license in India and TOEFL exam results, and then you will be able to give the FPGE exam. And after passing that, uh, you will be eligible to do internship as a pharmacist here in USA, and only when you have the required hours, let's say 1,000 hours, if you need to get the eligibility to write the NAPLEX exam. And then after passing the NAPLEX, and then you need to pass one more exam, which is jurisdictions that comes to there are two. For California, it separates CPJE, and when it comes
MPJ.
to the other states, it's MPJE.
Yeah.
And then you will be a licensed pharmacist here for wherever state you are looking into becoming in. And then so while doing the when it comes to the internship hours that you want to do here, you can do as a voluntary positions while doing your masters in any other degree. But you won't be able to do any paid internships or anything because if it's not in your specific field of masters. So let's say you are doing health informatics. If you if you are doing internship as a pharmacy here, you don't get the approval from your university by the international department because it might not be completely acceptable to give you a CPT, which is called Curriculum Practical Training letter. So there are a lengthy process. You have to look into many things before applying for anything because you need to be very genuine and do everything in a legal manner.
Yes,
Yeah.
definitely. So there is one more question we can take. Guys, we'll take just 1 or 2 questions now. I think we have answered all relevant questions. That was really a very good question. Okay, Janice Virani's question we have taken. What is the cost, approximate cost someone has asked. Chavneet has asked about the approximate cost of your 2 years healthcare informatics course.
Oh, it actually depends on the different universities, on the location of the university. So it varies from 25,000 to 35,000 per year. And again, if your university, if you
Guys,
get some
dollars.
scholarships,
Guys, dollars,
yeah,
25,000 to
that's
35,000
dollars.
dollars, not
Yes.
Indian rupees, okay?
Yes. That's, you just have to calculate all these numbers before thinking about doing any degree abroad.
Yeah.
But again, there many universities offer the scholarships, and again, you have the on-campus jobs that you can do while doing the masters, which can help you in uh, for your living expenses and covering some of your tuition fees. Yeah.
Okay, one question again. Do we need license for industry in USA? No, I don't think so. For the
I
industry, we don't
don't
need
think so.
license. No,
You
no, no.
don't need any license unless and until you want to do a pharmacist job.
Yes,
You don't need any license.
correct. Guys, Canada and MBA related questions we'll take later. Sorry, we don't have time because we have another class at 11:30. Okay, I'll take just one more question. Shivam, we have discussed this. You can just, go back and check in the recording, okay, later. Srishti's question is, good morning. I got admission in Northeastern University for MS in Health Informatics and MS in Regulatory Affairs for fall. with the current IT sector layoff, do you think health informatics is still a better option, or should I go for regulatory affairs for better stability? This is a really good question.
Yeah, that's a really good question. But again, it comes to your choice where you are more interested in. If you are interested in health informatics, you can absolutely go for health informatics. If you are more interested in the regulatory affairs, you can go ahead with the regulatory affairs. You don't have to worry about the IT sector layoffs to choose which degree you want to go in.
Yes.
If you do your hard work and you can be if you have yourself prove very competitive in the world, you will always have your opportunities open to you.
Yes, definitely.
Yeah.
So I will just add to this, guys. See the layoff and all. Literally look at them very closely. So why these layoffs are happening is because of, first of all, definitely recession is one of the reason everywhere in the world. Okay. And the second thing is IT recession is not, I mean, IT layoff is not because, it cannot be a reason for you not to join health informatics or healthcare, IT related courses, because they are not laying off the people who are having the multiple skills like you, right? They are laying off some specific population. Okay. And that population is like they have only, one type of skill like coding. Maybe, they just know Python. Everyone knows Python. I'm telling you guys. Okay. Frankly, everyone knows Python. Everyone knows, this coding part, right? The coders are everywhere. All are, BTech, CAC, IT, they all are coders. So there is a specific population. So you are going to the industry with a very specific skill, along with along with the IT part. You have the health information, you have the healthcare information, you have the additional degree in healthcare. So healthcare information and the healthcare IT is, having a wonderful option and wonderful, if I say, the future, right? So that layoff in IT is different. You just don't correlate everything with your skills, and don't correlate with you're not doing for not doing something or not going for something very interesting. So please don't think about that. And if you are interested in health informatics, go for health informatics. Okay. And if you're interested in regulatory affairs, definitely you should choose it. Okay.
And also to add to this, you are not just seeing the layoffs. The company which is doing the layoffs are also posting number of 100 plus jobs again for the
Exactly.
new
Yeah,
roles.
yeah, yeah,
Yeah.
definitely. So guys, we'll end here. Thank you very much. For D farm, this is a very interesting thing. Nehal Rudagi, for D farms, I'm coming up with a very good, 2-3 days career conclave again with the specific people, who addresses these issues. If I tell you, I know many things, but I want you to wait for some more time, and we will conduct one specific conclave for D farms. Okay. So with that, guys, thank you very much. And I hope you all have filled the, feedback form. Please fill the feedback form, and then only you go. You will get the certificate for this. So thank you very much, Dr. Priyanka, for this wonderful, more than 1 hour, nicely explained and very insightful session. Thank you very much. And thank you everyone for joining us to this webinar.
Thank
Thank
you.
you. Thank you, dear.
Thank you,
Thank you.
Dr. Rajit.
Thank
Thank you
you.
so
Thank you very
much.
much.